How are you all? Yeah, did you all apply for INICET November? Yes, don't worry, everything will be good. And whatever happens happens for your good. Okay. 17th one. Identify the mark structure. This is the cranial end. This is the caudal end. This is something streak, isn't it? Yes. Snap streak? No, it is a primitive streak. Let me show you the picture. Repeated and twisted PYQs only. You can see here, once the hypoblast is replaced by ectoderm, mesoderm is formed. Then while forming the mesoderm, this streak will grow. Okay, this indicates that the gastrulation is began. This happens in the second week of embryogenesis or the beginning of third week. Okay, what is its function? It serves as a site where cells will migrate, okay, from inward to form a mesoderm, endoderm. Okay, it marks the beginning of gastrulation and it defines the head body axis, that is head to tail, and also you can mark left to right. Okay, this side. Okay, this is present in the caudal, that is tail end region of the developing embryo. Okay, so hence this is a primitive streak. 18th one. Identify the normal anatomical variation given in the CT image. What is this small thing? It is tracheal diverticulum. No, this is the trachea, which is round structure. There is nothing coming from this trachea, right? So it is not tracheal diverticulum. Esophageal duplication. This is the esophagus. It's not a hollow structure, isn't it? So it is not a esophageal duplication. It is a right aortic arch. No, this is the subclavian artery and this is the aberrant right subclavian artery. Let me show you the picture. We have learned that arterial development in our previous papers. You can go and see there. I have explained 5 minutes, I guess. You can see. They have asked, first we have to know from where subclavian artery develops. It develops from the fourth arch artery and plus with the right seventh cervical intersegmental artery. But in this case, what happens is the fourth arch artery will disrupt. Okay, obliteration of the fourth arch artery. Hence, there is no direct connection between fourth arch artery and seventh arch artery. So, what does this seventh arch artery thinks? Okay, I am not having relationship with fourth arch, so I will directly come from this. What is this? This is the caudal part of left dorsal aorta. This one. This is caudal part of right dorsal aorta. So this will not regress. Okay. In normal people, this artery will regress. That is, caudal part of right dorsal aorta will regress. But here in this case, because fourth arch artery is not present, this will persist. So this will make a pressure on the esophagus. So you can see in the CT image there is compression in the esophagus, isn't it? Hence there is compression in the esophagus. The obliteration of fourth arch artery, there is persistent of this right dorsal aorta. Hence there is abnormal right subclavian artery and this will compress esophagus. This is called as dysphagia lusoria. Okay. It's easy question. Okay. So option is C. The 19th question. Injury to the posterior interosseous nerve leads to. Posterior interosseous nerve is a branch of which nerve? That is radial nerve. The loss of extension of the digits, loss of extension of the wrist, loss of supination, wrist drop. Okay. Let's see the radial nerve course once, so you will come to know the answer. This is the radial nerve. Okay, now Near the axilla, it gives one branch for triceps. Triceps has how many head? 3 head. So one of the head is supplied by the branch in the axilla itself. Okay. Next, it will come to the radial groove, and there also it will give another branch for a triceps, another head. Okay, then it will come down. While coming down, it will give another branch, that is extensor carpi radialis longus. Then it will travel down in the lateral epicondyle. Okay, this is lateral epicondyle. Travel down near the lateral epicondyle. It will divide into two branches. One is superficial branch, another will pierce the supinator muscle and go behind. Okay, it will form a posterior interosseous nerve, which is a pure motor nerve, supplies the extensor digitorum muscle, which helps in extension of the digits. Okay. Now in the question they have marked, if injury to the posterior interosseous nerve, there is palsy of extensor digitorum, hence there will be extension of the digits is lost, isn't it? That is finger drop. See, only finger drop is same. But let's see the other injuries. When there is injury at the axilla, when there is a crutch palsy, then there will be everything is gone. Triceps gone, this extensor carpi radialis is also gone, then this superficial also gone, and posterior interosseous nerve is also gone. So all the extension action is gone. That is, hence the elbow will be in the flexed position, wrist will be dropped, finger dropped, and sensory loss to the lateral 3.5 finger. Okay, the nail beds are spared because it is supplied by median nerve. Next, coming to the injury at the radial groove, here the triceps one head will be normal, right? So there will be just weakness in the elbow extension. Okay, the full extension of the elbow can't take place, but the weak extension can take place. But the wrist drop will be there, finger drop will be there, and sensory loss will be there. When there is lateral epicondyle fracture, there will be weak extension can possible because of sparing of extensor carpi radialis longus. But the finger drop will be there, and superficial branch, that is sensory loss, will be there. Injury at the D site, yes, posterior interosseous nerve gone, extensor digitorum will get palsy and finger drop. Radial nerve palsy, here you can divide into very high palsy, high and low palsy. Very high means that is crutch palsy, that is at the A site. Whereas the high palsy is in the radial groove in the Saturday night palsy, where the person will keep his arm on the chair. You might have seen in your first year textbooks. Okay, Saturday night palsy picture. The chair will press on the radial groove. Okay, hence there is site B gets injured, that is radial groove. Low palsy is posterior interosseous nerve palsy, whereas this C site is a lateral epicondyle fracture. Okay, hence option is loss of extension of digits. 20th one, the nerve related to the area marked in the picture has its root value from. Okay, they have marked this is the left lung. Here you can see the oblique fissure. This is the pulmonary artery, which is in blue color. Why? Because artery carries deoxygenated blood, whereas vein carries oxygenated blood. This is the anterior side. Here the phrenic nerve will come. What is the root value of phrenic nerve? That is ventral horn of C4. These are the veins. Okay. This is the bronchus. Here the aorta will come, and here one depression is for the esophagus. This is the oblique fissure, which divides superior and inferior lobe. This is the heart depression. Okay. Phrenic nerve has a ventral horn of a C3, C4 and C5. The main contribution is by ventral horn of C4. 21st one. This is our favorite question and examiner's favorite question also. But this time I have changed the image. Our favorite skull bone, we have changed it. What is this? This is the pterion. The marked structure serves as a surface marking for which anatomical structure? This is the repeated question, okay? That is, here which sulcus will come? Sylvian sulcus, which is also called as stem of the lateral sulcus. This question has repeated many times. You can see Sylvian's fissure is also called as lateral sulcus. It is present on the inferolateral surface. This one, inferolateral surface of each cerebral hemisphere, separates the frontal lobe from temporal lobe. What is pterion? It is meeting of four bones, which are the frontal, parietal, sphenoid and temporal bone. The fracture of the pterion, what is its importance? Anterior middle meningeal artery gets ruptured and there will be extradural hemorrhage. What are the structures lying deep to pterion? Anterior division of middle meningeal artery. Sometimes they will give accessory division of middle meningeal artery. That is wrong. Middle cerebral vessels, Sylvian fissure, which is also called as lateral sulcus. Insula, Broca's motor speech area on the left side, that is 44-45. Lesser wing of sphenoid, this is the bone which is underlining the pterion. It corresponds to the site anterolateral fontanelle in the fetal skull. Yes. So this is easy question. Coming to the 22nd one, the structure marked as a X in the image A has a direct connection with the which of the following structures marked in the image B. Okay, this X has some connection with one structure in this 1, 2, 3, 4. Which is that? We have to know. This is the cerebellum. This is the dentate nucleus. This has a direct connection to the red nucleus in the midbrain. Which structure? That is red nucleus. Okay, you know that. Let me show you. This is the cerebellum, which has a superior cerebellar peduncle, middle cerebellar peduncle and inferior cerebellar peduncle. This superior cerebellar peduncle goes to the thalamus and red nucleus. So here, which is the red nucleus? That is 1 is the red nucleus. What is 3? This is the substantia nigra. This is the superior colliculus, whereas 1 is the red nucleus. Whereas this is the substantia nigra, which is in black color. Here this is the crux cerebri. So X is the dentate nucleus, connects red nucleus of the midbrain. Okay, hence which one is the red nucleus here? 1. This is also twisted PYQ. Okay, so important question. Identify the structure. What is this? In exam, you can't zoom this much, okay? You can just see the cranial nerve piercing the dura mater. What is this? This is the oculomotor nerve. You can see here, this is the optic nerve. This is the pituitary gland. And here, oculomotor nerve. This is the trigeminal nerve and this is the abducent nerve. And here one nerve you can see, right? That is the glossopharyngeal vagus and accessory nerve. Okay. So hence option A. 24th one. A 15-year-old boy underwent splenectomy for immune thrombocytopenic purpura. During the procedure, the surgeon noticed bleeding while separating spleen from stomach. Okay, which vessels most likely implicated in this bleeding? Okay, first we have to know what structure connects spleen and stomach. What is that? Gastrosplenic ligament, isn't it? Yes, this is the gastrosplenic ligament. The surgeon noticed bleeding while separating this ligament, gastrosplenic ligament. So, what are the contents of this gastrosplenic ligament? That is short gastric vessels and left gastroepiploic vessels. This is the stomach greater curvature will come here. So this is the left side, okay, whereas the liver comes here, which is the right side. This is left side. So left gastroepiploic vessels and short gastric vessels come here. Even though this is greater curvature, the short gastric vessels is present here, okay, and also the left gastroepiploic vessels. So the bleeding is due to left gastric vessels? No. Short gastric vessels? Yes. Right gastroepiploic vessels? No. It is the left gastroepiploic vessels. Splenic vessels also? No. So answer is B. Okay, we have done with 2024 paper. If you want the PDF of the notes, let me know. You can mail me. Happy studying. If you have so much of tension, please keep it aside, because after 10 years, when you look back, you will feel that, oh my god, did I take attention for this small thing? Yes. So don't worry. Now, if we see 10 years back or 20 years back when we were in first standard, we were worried about the small exams. But do you scared of that exams now? No, right? So give your 100%. When you come out of the exam hall, you should be like, I have given all my 100%, but this is my result. That's okay. But I have given everything. Okay? So that confidence you should have. That confidence you will get only when you study again and again, revise again and again. My intention is just to make your day smooth. Okay, when you are not able to study, at least if you see these videos, no, you will get at least one or two lines for sure. You might not get my answers now, but when you solve the question papers, you will get to know the answers, and that one correct answer will make you very happy. That is cloud 9 feeling. Okay, so just listen to the videos, some of the key points where you have to see the questions, you will come to know, and you will also know the most repeated questions. I have stressed on it while starting the videos. I was like, I'll start a short videos, but somewhere I felt that my videos are becoming 1 or 3 minutes extra. It's just to make you understand. Okay, nothing else. If you are feeling my videos are very slow, watch it in a 2x speed. You will be okay soon. Okay, you can watch these videos 2 or 3 times. Yes, you can watch it. Trust me, you can do this. Okay, if you can't do this, no one else can do this. So keep hope on you, keep trying. Everything will settle, everything will be good. Okay, take care. Bye bye.